Okay, thank you, everybody, for either coming or tuning in to Encore Learning Prevents event. Today's event is fixing Social Security for the long run, a topic that I think will interest most of us here, if not all of us. We're lucky to have with us Jim Grefer, who is a PhD economist, who will take us through this. He's been a member of Encore Learning for 4 or 5 years and has taught several courses. And we're in luck because he's going to teach another one on Mondays on the economic history of the United States at 2 o'clock, I think you said. Yep. So getting that one early is going to be very popular, and it'll be in person. Let me just give a few tips here, tech tips, so you can enjoy this. Questions should be in the Q&A function for those of you who are virtually tuning in, not chat. I am Tom Adams, the moderator, and at the end we will do questions. But if you have an urgent question, either those of you who are present here or those online, something unclear, just raise your hand or send a question in. Jim will answer it or try to answer it. I think that's it. One other thing, Zoom, you can use the Zoom controls to display or hide a live transcript function. And when you leave the webinar, there will be a survey request. Please take it. It really helps us to improve our function here. And let me just say one other thing. Besides Jim and me, we have Carrie Frax, who's our professional, staff professional, and doing this both virtually and in person is very complicated. And we thank Carrie for being here to keep this thing going. Thank you. Over to you now, Jim.
Hi, everybody. Hello, and hello to everybody in Zoom land up there. Like Tom said, I am an economist by trade. I also am an economist by nature, so I think about things in an economic way. Social Security problem is a financial problem, of course, but it's also an economic problem, and it's sort of about how we handle resources as a nation. And so it's both a financial and economic problem, but also I use economic methods to home in on what I think are the causes of the current financial problems that Social Security is going to go through. So I would like to also take a moment and say that what we hear a lot is sort of political propositions about Social Security, or we hear these kinds of things, right? So what do we hear about Social Security? Well, we hear that it's going broke, so that's a common term. Now, some of us prefer a different kind of a euphemism, like bankrupt, maybe, or insolvent, those kinds of things. We're going to have to cut benefits by 20%. That's kind of the scare thing. Or to raise taxes even worse, right, by a third. And of course, you know, our leaders and our media and really the general public are really behaving appropriately on this. What I'd like to do today, or one of my goals today really, is to kind of reason our way through this whole problem. And so with that in mind, what I'd like to do today is first I'll discuss, you know, what exactly is the problem. I want to home in on what caused the problem. Many decades ago, I was in the Navy, and I was a mechanic in the Navy, and I discovered pretty quickly that unless you get down to the root cause of whatever mechanical problem is happening, you're not going to fix the problem in the long run. And I sort of take this to heart in this presentation as well. Then I'll sort of talk about, well, why should we care about the problem? And then finally, what are some ideas about what we can do to solve the problem in the short and in the long run? So first of all, what is the problem? Well, it is a financial problem, of course. And like every financial problem in the universe, it's an imbalance between income and outgo. And so we need to talk about that, right? We need to talk about the income and outgo. And so first we look at the outgo. Right? And these are beneficiaries that receive benefits every month. There are right now this year about 65.5 million beneficiaries, and they are in 3 different groups of people. The biggest group are us. is us. Retirees and the dependents of retirees. They make up almost 80% of total beneficiaries, and these are the ones that have the most clout in this issue. But we also have surviving spouses and children of Social Security beneficiaries who pass away. And we have a disability insurance in the Social Security system, and they're about 13% of the population of beneficiaries. On the income side, last year, the income to Social Security was about $1.25 trillion. Seems like a lot of money, but at a national level, it's just really a little bit here. But we have three sources of annual revenues. The biggest source, I mean, by far the biggest source, are the payroll taxes that we all paid for our entire working lives, right? Most of us, many of us pay for as much as 50 years of working. My first annual payment to Social Security was $70. So that was a pretty long time ago. There's also some federal taxes on a little bit of benefits if you're in a high income bracket, where you may be paying taxes on some of your benefits. And then the third source is the interest on the Social Security Trust Fund. I'll go into some detail about what that is in a little while here. So these are the outflows and the income. Today's problem is this. The Social Security system is operating from a deficit. And what that means is that the outflows to the beneficiaries is greater, or the value of the outflows is greater than the income from those three sources that I talked about. What that means is we're drawing from the principal of the trust fund. They're drawing that money out as we speak. Now, right now, we're not in a crisis. Social Security is paying out to its beneficiaries, right? It's receiving income. But although the Social Security Trust Fund is about $2.5 trillion, at the current rate of expenditure, they are predicting that it'll run out in about 10 years. And when that happens, then we will have a crisis. If they haven't fixed the problem by then, there will be a crisis. And then it'll be a way different thing to try and fix it. It's important to know that we've been here before. This is not our first rodeo, right? In the 1970s, they had literally the same problem, right? And this chart shows that. In this chart, the red and orange bars are the incomes and outflows of which I just spoke. But the important lines of this are the white line, which shows the difference between income and outflows. And that red dotted line is the 0 point. If the white line is above that red dotted line, they're in surplus and they're building the trust fund. Below that red dotted line, then they're operating from a deficit and they're taking principal out of the trust fund. And as you can see, about the late 70s, around 75 actually, in 1975, the system went into deficit and they were predicting that the Social Security Trust Fund would run out in about 10 years. Sound familiar? And of course, our leaders and the media and the general public were acting appropriately at that time also. To be fair, this is probably the father of the other one. So what were the problems in the 70s and the 80s that led to this deficit spending? Because they were different than what they are now. So first, all changes or any changes they wanted to make to Social Security had to go through Congress. So if they wanted to increase the benefits, go through Congress. If they wanted to change the tax rate, had to go through Congress. And of course, Congress people are politicians. So they were, of course, very generous. And that kind of helped to lead to the problem. The second problem they had was an imbalance of beneficiaries and workers. So the Social Security system was started in 1935. By the 70s, it was 40 years old. The number of beneficiaries was growing. The number of workers was not growing. Only about half of jobs were covered by Social Security at that time. And so they didn't really have a plan for this. So they needed to figure something out. The third thing was the baby boom generation. So in the late 70s, baby boomers were in their upper teens. So some of the older ones were in their 20s, maybe some going into their 30s, but they were a big population. And we did not have a plan for what to do when that generation of people retired. And finally, lifespans were increasing, as we all hear now, right? But they didn't have a plan for that. So we'll talk about those in a little while here. So what did they do? Well, they came up with the Social Security Act of 1983, and they changed some of the rules of Social Security. First, they made changes to the benefits automatic. So our benefits go up by the inflation rate, right? That's an automatic change. Congress doesn't get involved in that at all. The tax rate has been constant for the last 40 years, so Congress is not involved with that at all. So they made them automatic. Second was they increased covered employment. Like I said, at that time, only about 50% of jobs were covered, were paying into the Social Security system, and they increased that mostly by adding government workers and public school educators, state level, federal level, all that. They added, today about 95% of all jobs are covered by Social Security and pay into the Social Security system. Third, they raised the payroll tax. Before that, the payroll tax was in the neighborhood of 10.5, 10.5%, and they raised it to 12.4% of payroll, which is where it's been since 1983. And then they, as we all know, they raised the full benefit age from 65 to 67, and that they phased that in starting in 2002. And I think in the next 2 years, it'll be fully at 67 years of age. I was 66 when I became eligible for full benefits, as probably a lot of you guys were too, right? So that was the Social Security Act of 83, but here we are again. So this is the same chart as I had before, except this one is from 1980 to now, whereas before was from from the beginning of Social Security up into the 80s. And the white line, as you see, for many years was way above the red dotted line, and we were building on that Social Security Trust Fund. But in 2020, the white line went below the 0 point, and we went into deficit. And they're predicting that the trust fund will last about 10 years. And again, we're facing a crisis, and we have to do something about that. So this chart, the right side of this chart came from the Congressional Budget Office report on the Social Security. This came out in 2023. The left side is the data I just showed you of this chart. What CBO projects is that the long-term fiscal gap, that's the difference between the outflows and the inflows, is somewhere between 4.2 and 5.1% of payroll. You get a sense of what that means. If they change the payroll tax from 12.4 to 17.4, in theory, that would solve the problem, right? That's probably not politically possible, but that would solve the problem if they could do that. Well, things that cause the problem this time are different than what caused them the last time. And so we want to get a handle on what caused the problem this time. Before I get into that, though, I want to talk about assumptions. I got that little thing blocking out that word, but now economists have an image of using assumptions a lot. I think it's not fair, but we do sometimes make an assumption. I make one assumption in this whole kind of thing as well. I make a lot of estimates. Estimates are different than assumptions. So when I'm estimating inflows and outflows and, wages and income and all that kind of stuff, I use estimates, but that's not the same thing as an assumption. So the thing is that prior to the Social Security Act of 1983, a lot of people did a lot of heavy research to find out, number one, what was the problem, and number two, would the rule changes that we make actually solve the problem in the long run? So all the changes they made, adding covered employment, raising the tax rate, taxing some benefits, changing the age, all that was designed to fulfill or to keep the system in surplus for a long period of time before they had to start drawing from the Social Security Trust Fund. So the assumption that I make, this is one assumption, is if they got those projections wrong, whatever they got wrong, that I'm considering as a cause of the problem. If their projections were correct about beneficiaries and income and all that kind of stuff, that's not a cause of the problem because that was part of the plan. It was part of the model. And that's what I'll talk about is what was part of the model and what things they got right and what things did they get wrong. Causes. So that's how I'm homing in on what I think are the causes of the problem and the correct solutions or the long run solutions. So what are they saying are the causes? Right? Well, the main thing they say, and they say this loudly and often, is that it's the baby boomers, right? It's the baby boomers are a big population. They're putting a strain on the system, and it's not sustainable. Right? You hear that a lot. But as I showed you, they knew that the baby boomers were going to do this, right? This is what you call an age pyramid, population pyramid. Shows the percentage of the population at each of these layers of age, 0 to 5, 5 to 10, and so forth. This big fat thing right here at the bottom, that's our baby boomers, right? They were a big population at the time, and that's one of the things they worried about. The thing is, they knew that this big fat thing on the bottom here was going to become a big fat thing on the top here in another 25 or 30 years. And so they put that into the model. But they also did projections, and this is a projection of the number of beneficiaries that they expected. Projection is in the orange line, or projections of the number of beneficiaries every year, that was going to be every year. They went under 2060, this goes up to 2022. The blue line is the number of beneficiaries that actually happened, right? So it goes from 83 up to 2022. Now you do see like a little bit of a gap there, right? And so they sort of underestimated a little bit the number of beneficiaries that were going to happen when the baby boomers retired about there. Right? But there's a couple of things about this gap. Number one, this gap is a couple million people, which seems like a big number, but it's a couple million out of 60 million people. So it's really only about 4%. So they got their projections off by 4%. So as an economist, I know that's pretty good, actually, a pretty good projection. But the main thing about this is that the baby boomers began retiring in 2008. Well, what was going on in 2008? The economy went to the pot, right? We had this great financial crisis that started in 2007, or the housing bubble burst in 2007, the financial crisis, 2007. By 2008, unemployment was up to nearly 10%. Right? Well, at that time, the early baby boomers were becoming 62 years old and were eligible for early Social Security retirement, 62. Now, the reason why that's important, I say early retirement, so this gap represents some early retirements among the baby boomers. Right? The reason why that's important is because early retirement has no effect on long-term Social Security costs. And the reason is because you retire at 62, then you get less monthly payments than you do if you retire at 66, or if you retire at 70, right? You get even more. And the way they calculate the difference, how much more you get, is so that your lifetime expected benefits is the same, regardless of whether you start 62 or 70. They calculate what is your expected lifetime and your expected benefits during that time, and they reduce the amount you get at 62 by that amount. So while it does affect this little gap here, the early retirements does affect this a little bit, about 4%. It doesn't affect long-term Social Security costs because they're early retirements. So I maintain that this is fine. This is a fine projection that they made. They couldn't predict necessarily that many people would retire earlier, but since the cost has no long-term effect on the cost, and since this gap is pretty small relative to the total amount, I think that I consider the baby boomers as not a cause of the Social Security problem. And as you can see, that gap closed up around 2019, right? That's because we're not in an economic crisis anymore. I'm not necessarily retiring early. So baby boomers. The next one is increasing lifespans, right? That's a big one we hear all the time. Increasing lifespans. The lifespans increase, and it creates, some types of solutions that we'll talk about in a little bit here. The thing is about that, though, is that the planners knew this was going to happen, right? They had data from the previous 40 years. This chart here shows this bar here is 1940, and if you turned 65 in 1940, you were expected to live 12.9 years, right? If you turned 65 in 1980, you were expected to live 16.4 years, a full 3.5 years longer, by turning 65 in 1980 rather than 1940. They knew this, and so they made projections. And this are their projections. The orange bars are the projected increase in lifespans, right? Which they projected it would go from 16.4 up to 19.1 by 2020. What actually happened is expected lifespans grew, but it did not grow as much as what they projected. So they actually overestimated the long-term growth in the average lifespan after 65. So this is not a problem. Lifespans are not really the cause of the Social Security fiscal crisis. Third, what's the third thing we hear? This is not enough workers paying into the system. This is measured by what they call the worker to beneficiary ratio. It's just the number of workers for every beneficiary. So the reason why this matters and what we hear a lot about is because fertility rates are down. So fertility rates are the expected number of children a woman would have in a lifetime, right? And they made projections on that too. Now the blue, this early part of the blue is during the baby boom, right? And you can see that it peaked around mid-50s and then began declining a lot after the 50s. So right around here is the Social Security Act of 1983. You guys over here. And the orange, again, is the projections. And what they projected was that the fertility rate, while it had sunk to a low here in the mid-70s, was going to rise a little bit and then stabilize around 2.3 for the rest of the time that they cared about. Right? What actually happened was, well, it did go up a little. It went up a little bit, but then it stabilized around 2.0, and then at the turn of the century, it fell. And today, the fertility rate is about 1.6, which is pretty low. But the thing about this is that you would think that if the fertility rate in 1995 fell dramatically, that 20 years later, the number of workers for every beneficiary would also fall too, right? And so they thought about that. I mean, that is the statistic that really matters, is how many workers per beneficiary. So they made projections about that as well. The orange is projected of the number of workers per beneficiary. And as you can see, they thought it was going to be level here from 83 to about 90, and then it was going to start falling, and then really start falling around the baby boom generation until it was going to reach 2.4 by today. What actually happened was it stabilized for a longer time and then fell, but then it stabilized again around 2.8. And that's what it is today, is 2.8, not 2.4. So they actually overestimated how much that was going to drop, or underestimated what it was actually going to be. They did make projections here far into the future. And this chart on the right, both of them are the projections. The blue is just modern projections, and they project that at the current rate, the number of workers per beneficiary is going to decline to 2.1. They projected 2.0 by 2060, and so it's not quite that low. But the question is what happened, right? Our fertility rates went down pretty lot, right, in the mid-90s, and yet the worker to beneficiary ratio did not decline like they thought it was going to decline, or even as much as they thought it was going to decline. And the answer to why this was underestimated is immigration. You can see, so this chart shows immigration as a percentage of our total population from World War II to the present. And you can see there was a sort of a straight line, almost a straight line. Let me get my TV here. So it's almost a straight line here all the way until about the late 80s, right? It had risen from about 1% or 0.1% of the population to about 0.2% of the population in the mid 80s. Then we see this big, huge spike. And then we see numbers way above the trend line for the remainder of the time. And by the way, that last little drop here, that's COVID, right? That's a result of COVID. But this part right here on the right side suggests that immigration was much greater than what they would have projected, right? In fact, I estimate that this number that is above this trend line is about 15 million immigrants. So yes?
Do you know how many of those are adults of working age as
Well,
opposed to children?
we do have a sense of that. The thing about immigrants is they come over here at working age. That's why this matters, right? Because they come over here at working age already. Most of them don't even bring children. right? They come here, they're working age, they just want to start a new life. So this has happened. But the point, and I do know that we do have data on that. I don't remember just offhand, but the thing is that if you look at that population pyramid of foreign-born people, it's real fat in the middle. It's not fat in the bottom, getting narrow at the top. It's narrow on the bottom, fat in the middle, and narrow again on the top. That's about what I can remember right now. Anyway, immigration sort of kept the Social Security system from being in worse financial shape than it actually is right now. So that was immigration. So that explains. So, and the bottom line is that it's not the worker to beneficiary ratio is not really the problem. That's not what caused the problem. Why? Because they actually underestimated what it was going to be, and it actually turned out to be bigger than what they thought. So I maintain that it's not boomers, it's not lifespans, it's not the worker to beneficiary ratio. But if it's not those three things, then what is it? Well, in order to get a handle on that, you want to look at the causal factors of a financial imbalance, right? The inflows and the outflows, right? The revenues and the outlays. That's what you want to look at. You want to dig down into those and see what was going on. So what I did was I considered, so what changes, what causes revenues and outlays to change over time? And here is kind of a fundamental thing about that. Revenues grow with wages and the number of workers, right? The reason why it grows with wages is because of the payroll tax, right? 90% of the revenues come from the payroll tax. And if payroll goes up, then the revenues go up. And also goes up with the number of workers, which we saw. Benefits, on the other hand, grow with both wages and the inflation rate. And the reason why that is because initial benefits are a function of your lifetime of wages. But after you start collecting benefits, your increase in your benefit goes up by the inflation rate. And by the way, that's predicted to be about 2.6 this year. Come on, we're used to those 5s and 8s, aren't we? So the, and then of course the number of beneficiaries, which we saw was around 4% less than or more than what we thought was going to happen. So we look at revenues, so we look at these growth rates. So in the data, both wages and the inflation rate that was below their 40-year projections, right? The inflation rate, which is measured by the Consumer Price Index, or the CPI, was projected to grow at 3% annually for the end of time, right? But what actually happened in the last 40 years is that it grew about 2.7%, which is less, but it's not substantially less, right? It's within 10%. Yes, ma'am.
Is FICA capped at a certain wage level?
But we'll talk about that in a minute. Right, so the CPI was under the projection, but only a little bit projection. It's the same thing with workers and beneficiaries. So it's the same thing. They did come out, they did both, the workers and beneficiaries grew at less than what they projected, but both of them were within 10%. The workers were within were even less than that, but the number of beneficiaries were like 4% difference, right? So both of them were pretty close to projections. What wasn't within projections, anywhere near projections, was real wage growth, right? So real wages are your wages minus that are adjusted for inflation, right? The real wages. They had projected that real wages were going to grow at 2.5% annually. And what they actually grew at was 1% annually. You probably read that in the news, right? Wages are just not growing that fast for the last 40 years. Well, they grew at about 1%. Real wages grew at about 1% annually versus the 2.5% that was projected. That's a big deal. And you can see that in these charts here about revenues and outlays. The orange again is the projections of revenues, which were projected to grow at 6.5%, and outlays, which were projected to grow at 6.25%. Revenue growth was bigger than the outlay growth, and that's why they had projected a long-term fiscal surplus rather than the deficit we actually went to. But the blue is the actual, and you can see revenues grew at a less rate than outlays, and that's why that's kind of the reason why we went into deficit, is because revenues grew at a smaller rate than outlays did. These circles are supposed to help you guys out. So the problem looks like it's within revenues and wages specifically, right? That's what looks like the problem is. And so I want to look more deeply at we want to look at more deeply at wages. And what we see, what I need to talk about first is national income. So national income, you've probably heard of GDP, right? The gross domestic product. So national income and GDP are just two sides of the same. GDP measures the total value of everything that's produced in the United States, right? National income measures the total value of income for everybody in the United States. And since every penny of output goes to somebody as income, in theory, they're supposed to be identical, right? Now, obviously, they're not identical because it's different data, it's different kind of ways of collecting that data, but they've always been very, very close. I'm going to talk about national income because that's what wages are, it's part of income, right? So there's two categories of national income. Number one is the labor's share of national income, and that is wages and benefits. The second part is capital's share, the share that goes to owners of capital, and that's profits, interest, and rents. Right? So those are the five categories within the two categories. Now, Social Security tax only comes from that one category, wages, which is part of labor share. Right? That's where the payroll tax comes from, is wages. That's the only thing it comes from. So what I looked at was the wage share of the national income. What happened to it over time? And what we see is that from World War II up until about the mid 70s, it was pretty stable at a half of the economy. 49.7% was the average. And economists will predict that that should be stable if we have competitive markets, right? That it should be stable. But then what we see is in the late 70s and early 80s, it dropped dramatically and pretty steadily until now, until the turn of the century, right, where it leveled off at about 43.5% of the national economy. That's a 6-point drop. That's a 6-point drop. That's like 15% of the shares. So this helps me to home in on what really is the cause of the problem. Right, it dropped 6 points from 1978 to about 2002. So, okay, so one of the questions we need to ask is, okay, so if this share of the economy got lost to wages, who got that share? Somebody got that share, right? So first of all, part of it went to benefits, obviously. So the labor share went down, but it didn't go down nearly as much as wage share. And part of that wage share went to benefits. It's just the difference is it's the labor share minus the wage share is the benefit share. And when I talk benefits, I'm talking about retirement programs paid by your employer, health insurance paid by your employer, life insurance, all kinds of insurances, even Social Security, the employer share of Social Security is considered a benefit, right? But what we can see here in this chart, so this is the benefit share of national income, and we can see from 1950 to 80, it was pretty stable at 13.8% of the population of the national economy. But then around the 80s, it started increasing steadily and dramatically until the turn of the century, until really the mid 90s, it went up to 16.3%. So that's a 2.5-point increase in the share of the national economy that's going to benefits. This accounts for about 45%, a little less than half of that lost wage share really went to benefits. Part of it went to corporate profits. So that was one of the, it's not labor share, it's capital share, and part of that is profits. And about 70 to 75% of total profits is corporate profits. The reason why I focus on that is because it's easy to get data on that. But here's profits as a share of the national economy. And you can see this is starting in 1980, so it's not a lot easier to get data on that. But you can see it was steadily climbing from 1980 all the way up to now. Back in those days, it was about 4.9% of the economy. Now it's roughly 7.5% of the economy. So a gain of 2.5 points of the national economy. And it also accounts for another 45% of lost wages, right? The other parts went to interest and rents and things and other, of capital share, right? So, so this accounts for the loss in wages. These are the two categories that took up what was lost in the wage share. Yes, ma'am.
When you're talking about the, benefits. employee
This
benefits-
is corporate profits.
No.
Before I was talking about benefits.
Yeah.
Right here, I was talking
Okay.
about benefits.
Benefits being like my pre-tax health insurance
That's
deduction.
correct. Yes,
What about the employer's share of that insurance premium that they pay?
that is what benefits are. The amount that you pay to health insurance, for example, if you pay 20% of health insurance and the employer pays the other 80%, that 80% is what's part of these
So
benefits.
that's what you're talking
That
about.
is just,
What the employer.
otherwise it's not really a benefit. You're paying for it, right?
Well, but paying for it pre-tax, that's why I was wondering if you.
Well, pre-tax, that's a good point. And this actually includes this share here, when they do the calculations, they being the Bureau of Labor Statistics or the Bureau of Census or those kind of places, they figure that as well.
Okay, all right.
Okay, so this accounts for the lost share of wages or a share as a part of the national economy. But there's also this idea that within the wage share, there was lost wages that are become untaxable to Social Security. And the reason why this is untaxable is because there's a maximum taxable wage. So this year, the maximum taxable wage is $168,000. So if you earn, let's say, for example, you earn $200,000, 168 of that will get taxed to Social Security. They'll take out 12.5% of that 168, and that'll go to Social Security. The other 32 will not be taxable to Social Security. Anything over 168,000 will not be taxed to Social Security. Now, the reason why that's important is I have these two charts here. So the two charts, first one, it is the top 10% earners share of wages. And you can see that in 1983, the top 10% of earners earned about 30% of wages. And they paid about 23.5% of Social Security taxes. In other words, about 80% of their income was or their wages were taxable. Right? They were 30% of total wages, paid about 24% of Social Security taxes. By 2022, though, the top 10% earners were earning almost 40% of wages, and we're only paying 20% Social Security taxes. In other words, for the top 10% of wage earners, only about half of their wages are taxable to Social Security. They get taxed in other ways, but not to Social Security. This accounts for about 30% of lost taxable wages, right? So with the lost wages, 90% were those two categories, profits and benefits. But this is about 30% of the wages that were taxable before are not taxable now. Yes.
With regard to the lost wages, I noticed your diagram only went to 2020, I think.
Well, the bottom numbers, these bottom
2019,
numbers,
but I mean-
these all go to 2022.
Okay.
It's just that the bottom numbers don't always align mathematically.
You're on the news so much that the wages had gone up, the average worker.
Well,
You
they
know,
did go up. They went up by 1% a year for the last 4 years.
but not in the last year, not even more than that. I mean, it's just on the news. It seems like, the lower wage workers, maybe it's because they're lower,
Well,
have gone like
yeah.
McDonald's or 20.
No, that is true. The last couple of years are.
I mean, really gone up.
And as an economist, I deal with averages, and you are correct. The last couple of years, real wages have gone up. That is true. Well, they went up more than they had been. Yes, that is correct. But that was true. When I say 1% average annually, in the 90s, they went up more than 1%. But in the 2000s, they went down less than 1%. And in the 2010s, after the financial crisis, they were actually a little bit negative. Real wages weren't even above zero. So it changes over time. And what I showed was the average 1%. And all these things are averages, right? They're averages of corporate profits, averages of benefits and all that kind of stuff. So with these numbers in mind, I put together this little chart here. The left bar is 1980. The right bar is 2020. So what I'm showing here are these components that I just talked about and the share of the economy that they were and the share of the economy that they are now. So on the bottom, right, this blue bar, the blue part or the dark blue bar, those are corporate profits. And in 1980, they were 4.9% of the economy. In 2020, they were 7.5% of the economy, or 2.6 percentage of the economy. They went up. Other capital share, interest and rents went up 1 point. Benefit share went from 13.8 to 16.3, which was a 2.5 point change. Wages not taxed in Social Security because they're above the maximum went from 14%, 14.9% of the total economy up to 17.5% of the total economy, which was a 2.6 percentage point raise. And finally, wages that are taxed to Social Security went from 36.9% down to 28.2% of the economy, or a loss of 8.7 percentage points of the national economy. And this is what I'm saying is the causal factor. This is the main causal factor.
Okay, so just looking at that chart, look at the year that was chosen. It says 2020. Isn't that a bad year to use because of COVID? I mean, everything is going to be skewed unless I'm missing something. I'm a detail person, so I'm sorry to.
Okay, so you're right. I do put 2020 there. The thing about 2020 is that some of the data I got out. I think most of this data was 2022. Actually, let me go back.
2022.
Yeah, I've been using 2022. I typed that wrong. This is not 2020. This is 2022. And the thing, what you're trying to say is that COVID messed things up. Well, before and after, right?
Yes, right.
Right. So the thing is that COVID brought wages down, but post-COVID brought wages back up again, right? That's what happened with the COVID thing. The economic boom of 1990 brought wages up. The recession of 2008 brought wages down. That's why I can only deal with averages, right? And even with these numbers here, if that was 2020, if that was exactly what I put in there, this is still an average over the last 20 years, right? With all those things. So let me get it. Anyway, so this is what I'm calling the major primary cause of the Social Security financial issue. Wages did not keep up. Wages are where Social Security taxes come from. That's where Social Security revenues come from, is wages. So a lot of researchers look at the possible causes of this wage decline, right? And especially tax wages to Social Security. They talk about the decline of union membership, which went from 25% of workers to 7% of workers in the last 40 years. Whenever you think about unions, they do bring wages up, right? So that's one thing. Corporate transition from stakeholder to stockholder focus means they're focused on short-term profits and payments to shareholders, payments to upper management people. Whatever you think about this, whether you think corporations should be doing this or not, it does lower wages, and that's part of it too. There's this incentive, right, to trade wages for non-taxable benefits. And that's a lot of what happened. Why benefits went from 30% or from 20% of the people's income to 30% over that period of time is because of this incentive. And then of course there's these gaps, expanding gap between high earners and low wage earners as a result of technological changes and the increase in wage, a big increase in wages for educated people versus people who are not so educated as well. That's what caused the top 10% to go up so high. Anyways, we could debate this here for months. It's a little out of the scope of my talk, but I do want to bring them up as possible causes that people should look into of what we saw in the declining wage share. So what do we include in this section? The primary cause, what I'm calling the primary cause of the financial gap that we're having right now is the decline of the wage share of national income and the rise of untaxed wages. And one other thing I want to bring up is that because the benefit share went up, benefits largely go to people in upper income levels. The top 10%, all the non-taxable income or non-Social Security taxable income goes to high income workers. So what that means is that the burden of the Social Security revenue or the tax revenue is falling really on lower and middle income workers. in a big way. So a question we want to ask is, why should we care? And the reason why I ask this question, why I think this is important, is because they're not going to cut my benefits. I don't think they're going to cut your benefits. And I believe this for these reasons. Number one, they did not do this in 1983. I mean, they did a lot of things, but they did not cut anybody's benefit that was collecting their Social Security. Number two, people over 65 are 20% of the population of the United States right now. They're 30% of voters. So people over 65, people who are collecting Social Security are a big political power group. And that's another reason, because politicians want jobs, right? There's also a sense of a social contract. So I've been paid in the Social Security system for about 50 years. I've paid them a lot of money. And I don't consider this as something that they give me. I consider it as something they owe me. And I think that there's a general sense that that's true, that we've earned Social Security. And that's one thing that will keep the politicians from cutting our benefits. It's pretty optimistic, I know. So then the question is, if they're not going to cut my benefits, why should I care? And so I want to get into that a little bit. So in order to do that, we'll first look at senior poverty. This is the poverty level of people 65 years old and older. Now, in the 1930s, when Social Security started, the senior poverty rate was 60%. That means 60% of people over 65 were considered to be in poverty. Now, I'll grant you that there was a depression going on at the time, and that certainly contributed a lot to that. But this is a chart of the poverty rate for the blue line. The upper blue line is people 65 plus. The red line is everybody else. And you can see in 1959, so this chart starts in 59. So 59, we were still in the midst of a post-World War II economic boom. And yet 35% of senior citizens were in poverty in 1959. Compare that to the rest of the population, only 16% were in poverty at that time. Of course, by 1959, Social Security was really chugging along. In the mid and late 60s, you had Medicare. And so this poverty rate that went for senior citizens declined pretty dramatically until this was the mid to the early 80s, when it sort of leveled off. And today, the poverty rate for senior citizens and for the rest of the population is about the same at 9% poverty rate. But Social Security is not just a poverty program, right? There's other things as well. And to see that, when we think about the 100 years prior to Social Security. So Social Security Act of 1935 is when Social Security started. 100 years before that, with 1835, what was going on in 1835 was the first industrial revolution. Huge technological, social changes. And we can see that in this chart. So on the left side, so each of these bars is a census report from 1800, 1860, 1900, 1930. In 1800, 90% of workers worked on farms. We were an agrarian society. That's what we were. We're farmers, for the most part. But then first industrial revolution came along, and by the beginning of the Civil War, that was down to about 55% of workers were farmers. Right? By 1930, only 20% were farmers. Now, the reason why this is important is because in an agrarian society, households are made up of multi-generations of people, right? So great grandma and grandpa and son and grandson and great grandson all lived in the same household. You didn't worry about what was going to happen to you when you got old, right? You were living with your family, they were going to take care of you. But what happened, in addition to farms not being the big employers anymore, is that families started moving into cities. And that's because the factories built in the cities. That's where transportation was. That's where resources were. This is where the owners lived, right? In 1800, only 5% of families lived in cities, according to the census. By 1930, when Social Security started, 56% of families lived in cities. When you live in a city, right, you don't live in multi-generation homes, right? You live in single-family dwellings. You live by yourself. And you do worry about what's going to happen to you when you get older. you may not be able to depend on your family to take care of you because you're not living with your family. You certainly couldn't expect your employer to take care of you. Employers in those days had no retirement benefits or anything like that, health benefits or anything. You couldn't depend on the government. There were no government programs, right? So what happened was this. How did people retire after industrialization, right? So this chart shows the results of surveys given by the Social Security Administration. People 65 and older. Asked the question, your last job, how did you leave it? Why did you leave your last job? And in 1942, that was the first one they did, was in 42, 56% of the senior citizens said, I left my last job because my employer told me to leave. Call that involuntary retirement. That's what that was. Another 34%, that's the red bar here, retired because of health problems, which I consider a type of involuntary retirement as well. Only 10% of the population said they retired voluntarily. In those days, involuntary retirement was the main way that people retired. They retired because of their health, because they were told to. Then Social Security came along, Medicare came along, and by 1982, in a very similar survey, only 20% of people, respondents, said they retired because their employer told them to, and only 17% because of health reasons. A full 63% of people over 65 said they voluntarily retired. That's what Social Security did. It turned involuntary retirement, which was the primary way people retired, and turned it into voluntary retirement. Right? Even today, only 55% of workers participate in employer-sponsored retirement. This is data from EBRI, which is I don't remember the acronym now, but they do a lot of work on retirees, what they do, retirement programs. And in fact, only 13% of small companies, which is defined as 100 people or less, even offer retirement programs. Over 40% of retirees, now this is a Social Security research paper here, over 40% of retirees rely on Social Security for at least half of their income. Social Security is more than just an anti-poverty program. It is an aging with dignity program, and that's why I think we should care about this problem, even if they're not going to benefits. So now we explore some solutions, Craig. First of all, Social Security is a financial problem. As we've said a few times already, we're going to need to raise revenues or cut costs in some way. Right? The question isn't when or what. The question is how and who's going to pay. Right? That's the question. To get a sense of the problem, revenues after 2034 will only cover about 78 to 83% of benefits. After 2034, the revenue gap is going to be 4.2%, between 4.2 and 5% of payroll. That's the problem that we got to solve. So some very long-term solutions. These are very long-term solutions. I've talked about unions. Unions are neither more nor less a part of a free market than corporations are. Right? They're just organizations, right? They're organizations where they gather workers together. They have special benefits under the law that employers are not supposed to try to stop them and things like that. They're not part of a free market, but neither are corporations. With their limited liability and their special tax breaks, corporations are not part of a free market. So you might think they're necessary, but they're not part of a free market. Neither are unions more or less corrupt than corporations. They're just organizations, or any kind of organization. Some of them are corrupt, some of them are not. We're not going to change what's going on with unions until we know that this is true about unions. Stakeholder focus just means that corporations are held accountable to communities and workers as well as the stockholders. And you may think that stockholder focus is okay, especially if you've got like 401ks that are a lot of equities in there, but that's what stakeholder focus means. The final thing, immigration also gets a bad rap. Immigration is good for America, and most economists agree with that. Immigrants are just families trying to make a better life. They're, for the most part, they're very productive. They actually start new businesses at a far higher rate than native born. Immigration actually adds to and does not subtract America in America's well-being. And until we get this, until we know this to be true, which most of us do think, we're not going to be able to solve the immigration problem. But anyway, again, I just bring these up as, you know, these are not really directly focused on Social Security, but they are sort of indirectly affect Social Security, and so that's why we're bringing them up. And then, of course, we have popular proposals, right? These are the ones that are politically popular. Probably the most popular one is to raise the retirement age from 67, which is what it is now, or will be in a couple of years, to 70. And the reason it's popular for two reasons. Number one, the CBO, the Congressional Budget Office, estimates that by raising the age of full retirement to 70 would reduce outlays by 13%. That would solve about half of the fiscal gap. So that's one reason why it's very popular. Another reason why it's popular is because it doesn't have to cut current retirees, right? You can kick the can down the road. And that's always a popular position, to kick the can down the road. But there's a big problem with the idea of raising the age. And that is, there's really two things. I know you hear a lot about, well, people who work physically, right? They may not be able to work after they're 62 or 64, right? And that is true too. But this is actually a research question here. There's a gap in the expected lifetime after 65 between people who are high and people who are low income. And by high and low, I don't mean real high and real low. I mean the top 50% versus the bottom 50%. Now, in the people retiring in the 70s, this gap was only about a half a year, right? After you age 65, you know, people in the upper half expected to live 15 years, people in the lower half, 14.9, is pretty close. But now people are retired in the last 10 years or so. The gap is about 5 years. The difference between 16.1 years after turning 65 to 21.5. That's a big difference. And as you can see, this gap continues to widen. I see nothing in our future that says this gap is going to narrow over time. Basically, what that means is by raising the age to 70, you can put most of the burden of the fix on people in this lower half of the income range. In fact, New York Times just came out with an article a couple of weeks ago. They didn't do income levels. What they did was education levels. And they found similar results for people with high levels of education against people with low levels of education. So here's some solutions that are actually focused on the causes that I just brought up, right? So the first one was revenue shares lost to high earners. And this is also politically, I guess, a popular program too. And that is, I'm sorry, these are the three things here: loss to high earners, loss to benefits, loss to corporate profits, right? So the first one, revenue shares lost to high wage earners, non-tax wages, right? This is a popular, is just to increase the maximum tax. Right now, I said it was 168,000. There's a multitude of proposals about how we should raise the maximum taxable income. The CBO, again, they do a lot of estimating. It estimates that eliminating the max taxable income completely could close about almost 90% of the fiscal gap. This seems politically unfeasible to me. Not just politically unfeasible, but what you'd have is you can't just start charging them taxes or increase their taxes on Social Security without also increasing their benefits down the road. And what you'd end up with people making $1 million would get $500,000 in Social Security, and I don't think anybody's going to want that to happen. So I think this is to actually eliminate the max taxable income is not feasible. But here's the thing: in 1980, about 95% of wages were taxed to Social Security. Today, it's closer to 85%, or less than 85%, in fact. If we were just to increase that, the max taxable income, so that 95% of wages were taxed to Social Security, we could have fixed somewhere between a third and a half of the fiscal gap. And I think this is politically feasible. I know they're going through all kinds of things like, well, we're not going to tax between 250 and 400. I find that silly, but I'm not a politician, so I think that's I think if we just simply did this on the bottom right here, that could solve a lot of problems. Other cause-focused solutions, revenue shares lost from wages to benefits. So health insurance is about a quarter of all benefits. In the past, health insurance paid by your employer was kind of necessary. And the reason it was necessary is because insurance companies don't want to insure sick people. Right? So if you went there by yourself to get health insurance and you were sick, you probably wouldn't get health insurance back then. Right? So what happened was, because of this, the employers offered what was like a group plan. In a group plan, you don't single out individual sick people or individual well people. It's all sort of averages out. And so that was an important way, and some way that we actually needed to do with health insurance. But with the Affordable Care Act that passed in 2010, that's not really necessary. Health insurance companies can't really discriminate against you because you're sick, right? They have to charge you the same as they charge everybody that's my age, and so forth. So the question is, do we really need health insurance provided by employer as much as we did before? It's still nice, but is it necessary? So what I think is that if we just tax to Social Security a portion of that, like maybe everything above $8,000 or $9,000, we could close a great deal of the fiscal gap because it's such a big part of the national economy, is health insurance. This is one of the solutions that I think could be politically feasible and would help close a lot of that Social Security gap. Revenue shares loss of non-tax employer profits. So this is more controversial, probably harder to pass. But if you were to increase the employer's share, right now they pay half, which is 6.2%. If you increase that by maybe 1.5%, you would increase corporate taxes by about 10% and could close about 20 to 30% of the fiscal gap. So I think these are solutions that they should be focused on. They actually are focused on the cause of the Social Security problem. They can close much, if not all, of the Social Security gap over the long run. So now, in conclusion, Social Security is not going broke. It's just facing a financial gap, right? We've all done that before. Just like it did in the 1980s. And they solved it in 1980, and I think they'll solve this. Primary causes of the fiscal gap is the long shift in national income away from taxable wages. Right? That is the primary cause of this gap. The burden of such taxation, as I've said, has already fallen more heavily on low-income workers and middle-income workers, and I think we should pay attention to that whenever we decide what kind of solutions we're going to come up with. Long-term solutions should focus on root causes and not simply be across the board tax increases or wage grades or anything like that, and they certainly shouldn't be just politically driven. They should be financially driven. Social Security is an aging with dignity program. We need to fix it, and I think we should. Thank you.
Thank you. I'm going to first turn to the crowd here for questions. Should I use this? Yes. So if you have a question, raise your hand and I'll come see you.
Please going to come over with the microphone so that your voice will be recorded.
We only want tough questions.
This might be a tough question. One thing you didn't address that I always heard about on the news and papers was that the Social Security Fund,
Trust fund.
was raided.
Yes, indeed.
And if you can address that, and also one of the ins was interest on the fund,
Yeah.
and I would think with inflation.
I thought that was one of my charts here, and it turned out I must have deleted it trying to get this thing less than an hour. But the thing about the trust fund is this: there's a couple things. First of all, it's about $2.5 trillion. The second thing is it is real. I know that a lot of people are saying, well, it's not real. It's just a government debt. It's government taking money out of one pocket and put it in another pocket. It's not real, but it is real. And as an example, so it's called a trust fund, and the federal government has about 150 trust funds. There are a lot of trust funds. One of them that you might be familiar with, it kind of gets to the point, is the Military Retirement Trust Fund. That is a trust fund. Every year, the Department of Defense gets a budget, and they put part of that budget away for military retirements. And that is a trust fund. They buy special securities, treasury securities, and that earn 3%. And that's untouchable by law. So that's the same thing with Social Security. It is not touchable by law. It has never been rated. Now, what can happen is that they can borrow money
Yeah, well,
on the Social Security Trust Fund, but they're required to pay it back in a very short period of time with interest. So it's not rateable, but you can borrow from it. It is real. They buy special treasuries that earn 3%. And that's part of the Social Security revenue funds. So what was your other question?
no, it was just part of that. Also, I wondered what happened to the windfall? We always heard, over 1 million people died because of COVID and 70% were from seniors, 65
So
and
Social Security
over.
beneficiaries passed away, is that what?
And
Okay.
a whole bunch of us
Yeah.
disappeared.
So,
So where is the windfall?
yeah, there was a lot of people who died from that. But in the first, okay, so there's a couple things. So number one, most of the people that died from that were very old and weren't going to collect Social Security much longer anyway. The second thing is a lot of people, when you think about deaths, 1 million people seems like a lot. Seems like a really lot. But compared to the population of the country, even compared to the population of Social Security beneficiaries, it's not that big. So it's just where I guess I've read that some people were calling the potential windfall, but I think that they were exaggerating as well. Hyperbole.
Anybody else? Dick, come over there next.
I remember reading a dozen years ago when the Obama administration and Congress actually seemed to be getting a grip on this problem. That
They were
one of
beginning to
the,
talk about this problem.
yeah,
Okay.
well, one thing they talked about was that the CPI is a very poor measure of the cost of living increase for this senior population.
Sure.
And that tying increases in benefits to the CPI exaggerated the benefits, and using some different measure of inflation, some other, I can't remember what they were
So
talking.
there are several measures of inflation, right? And so there's the one that we use here for Social Security is the CPIE is what they call it, right? It's just a general one that you hear in the news a lot. There are people who say that some people say that overestimates the actual inflation rate to seniors. Some say that it underestimates. There is a sense that senior citizens spend money on different things than young people do, and that's maybe what they should concentrate on. I don't think that there's a consensus anywhere at all about what should happen. That the CPI is as good as anything, and it's once in the newspapers all the time. I think it's the most politically feasible way to raise Social Security. And so I think, I understand what they're saying, but I don't necessarily agree that the choice of CPI is all that big or should be the major concern on that.
Thank you.
Oh, here, somebody had a question, yeah. Ladies first, no?
In Congress, is one party more likely than the other to push for a reasonable fix? And are there any individuals in Congress who are really pushing hard for this?
So the politics of Social Security is always hard. I don't really think that one party is more likely than another one to do something. I think that ideologically, one party is less likely to really care about it than another party. The Democratic Party consider it sort of their creation. And plus, I think that they tend to be more inclined to have government help people out. So I think that they're more inclined to fix it for the long term than the Republican Party. But I don't really see any activity coming out of the Republican Party Party either. I think that they're just ultimately going to have to get together and solve it. That's what happened in the 80s, right? The Republican Party, which was opposed to Social Security for many decades. The Democratic Party, which had created Social Security, fought tooth and nail over that. But you can see in the results that they came up with to fix the problem that they finally did come together and did multiple kinds of solutions regardless of ideology. And I think the same thing is going to happen this time. Be warned though, I tend to be very optimistic about what goes on in politics in our population. So you can take that however. Does that answer your question?
Well, any individuals working particularly hard on it?
No, I don't know the individuals that are working on this. Yes.
One of the presidential candidates says that part of the problem with Social Security is that we are giving Social Security benefits to immigrants who are not citizens. Would you address that?
So, okay, so, yeah, okay, so you're talking about undocumented immigrants. Undocumented immigrants, for the most part, pay into the Social Security system. They do so with fake Social Security numbers and through their employers. But because they're undocumented, they will never collect a benefit, ever. And so they're paying into the system, but will never take out of the system. So, I hesitate to say, well, illegal immigration is good for Social Security, but kind of financially is better for Social Security. So,
If they become citizens, then they,
yes, if they became citizens, if they became citizens, or even if they just became residents, if they became documented residents, they could still collect on Social Security. But they'd have to go through that whole process.
Okay, now I'm going to switch to the online questions, and we have quite a few of them. The first one is, does the Social Security Trust Fund earn an optimum rate of interest without risking its principal? Or could that rate be improved conservatively to yield more revenue?
Okay, so the Social Security Trust Fund earns 3%. I mean, that's what it's required to earn, it's 3%. This is not an optimal amount. This is just an amount that they're required by law. It buys special treasuries that earn 3%. The military's retirement system does the same. I don't think you can change that. I know there are people who are arguing that maybe we should privatize the system to allow some of that money go into, equities and things like that. That's a whole debate all by itself. But there's no other way right now, according to law, that it can earn anything but 3%.
Next question is, what about hedge fund managers who take their pay as a pass-through, not subject to FICA?
Right.
I think that's
So that is another hour-long talk, actually. So hedge fund managers have special tax breaks, and a lot of people are debating whether that's fair or not. I don't really have a good sense about how that affects Social Security. If you were to turn that money into wages, then you can tax it as Social Security. But until that happens, you're not going to be able to do that.
But I imagine most of them get a salary that near the maximum amount.
To the extent that they're actually receiving wages, they pay that into Social Security.
Okay, next question. Also in the 1980s, the corporate backlash started and many industries moved factories overseas to use sweatshops in places like Indonesia and Mexico, et cetera, et cetera.
So the questioner is arguing that somehow the tax is causing corporations to move overseas. There may be some extent to which some corporations move overseas to save costs, and taxes may be one of those costs they try to save. I will say that I've worked for a couple of companies that built factories overseas. What they discovered was, yes, cost of labor was cheaper, cost of taxes was cheaper, but the infrastructure that they needed to actually do business and build value into their businesses was lacking most of those places. So many of them moved right back to the United States because they needed the resources and the infrastructure and the labor force that we have in the States. So this is always going to be an issue. There's corporations that move to other countries, but I think that as long as we are providing resources and infrastructure for companies to do business, they're going to want to stay here for the most part.
Next question is, what has been the rationale to cap the maximum income subject to the Social Security payroll tax? And in your opinion, has it been wise? Is there a legitimate reason to continue to have any cap, or only because raising taxes has been a third rail proposal politically?
Well, part of it is certainly about the third rail of raising taxes. I will grant that. But there's also a sense that you have people making $1 million paying 12% of that into Social Security for their whole working life. Then later on, they're going to be getting about, probably, 400,000 or whatever it is, 300,000 a year in Social Security taxes. And I think that's politically untenable. I think that they have a maximum because they want to have a maximum benefit that they pay, which is politically feasible. And so they need to raise the maximum income level, I think. But they also need to give benefits to the people who are paying more in Social Security taxes. They have to increase the maximum benefits that are allowable. And so we need to keep that within some range that's politically feasible.
If payroll tax cap were set at the 95% number, what dollar amount would that equate to? I think you covered this.
You know what? I think that's in the neighborhood of $450,000, but I haven't really done all the math on that. So that's why we have CBO.
The next one is, what government agency has been charged with fixing this problem?
What, Congress. I guess Congress, right? Well, with the help of Social Security Administration, right? So they'll help them. They helped them the last time too, right? They do a lot of research. The Social Security Administration does a lot of research into all these kinds of things. They've got very smart people looking to what we expect for the economy, for the demography, for everything that's going to happen in the United States. Congress should use their research, use their projections to help them, create new rules to help solve the fiscal gap.
What do you think of ex-President Clinton's assertion about job creation between the 3 Democratic administrations and the 3 Republican administrations since 1989, the 50 million to 1 million? Washington Post appeared to validate. Any thoughts?
Okay, so that's a little outside this topic. However, you know what? You always have to be careful about these statistics. So what he said was true. From 1989 until now, 51 million jobs created. 50 million of them were created during Democratic administrations. But we're kind of overlooking the fact that we have a mixed government, right? We have a Congress and a Senate, right? They can be a different party. That's number one. He starts in 1989, which means that the Democrats were presidents for a little longer than the Republicans if he started in 1980. So if he started with 1980, the number would be 67 million new jobs were created, 50 of which were in Democratic administrations. If you actually look at whether the administration was Democratic, Congress was Republican, right, and did a deeper research into that, you might find that these statistics change a little bit.
Next one is, can you make your slides available?
I'll give that some thought.
And also, would any of the financing solution be on the benefit side, say raising the retirement age on the top 2 quintiles? Would you make any improvement in benefits?
So are you asking, should they increase benefits or should they cut benefits in order to close the fiscal gap? I'm not sure I understand the question.
I think he's talking about benefits.
All right, well, let me just address that. So the idea of cutting benefits. So raising the age for the full benefit is just a way of cutting benefits. That's what that does. That's, you got cutting benefits, raising taxes. That's just one category of cutting benefits. Through my whole process, I was sort of focused in on what were the causes of the Social Security fiscal gap. And I didn't really see anything that showed that benefits were anything other than what had been projected over the long run. And so the benefit side of the equation, I didn't include that as a potential solution because it wasn't one of the causal factors. And that's what I was looking at, was what were the causal factors? And it almost exclusively had to do with wages, which is the revenue side. So I think that cutting benefits, in certain ways might be popular but it wouldn't focus in on what the cause of the fiscal gap. And so, I don't include that as a.
Two more questions. Do you have any justifiable hope we might see a bipartisan group / commission formed to formulate solutions that have a chance to succeed?
Yes, I am optimistic that it will. They will form commissions, groups of people who talk about this stuff and proposal things, and that they will solve the problem. I am optimistic. that they will.
After the elections, of course.
Well, right, well, there's always an election, right? So the thing was, if you look at the 1983, right, they didn't actually solve the problem until the trust fund was all worked out. So they waited a long time, and I think they'll do the same thing. They won't actually start, it'll be like the Social Security Act of 2030.
Last question, and then I'm going to go talk about future programs here. It seems that your proposed solutions will induce employers to reduce wages by a comparable amount of the extra taxes collected. Therefore, the burden of saving Social Security fall on the same workers whose wages have stagnated over the past 4 decades.
It's possible. So there's a sense in this question that employers will simply change whatever increase in costs that they have, they'll just put it on employees. And there's a sense that is true. But the question or the answer is yes, it's true in some cases, but it's also not true in some cases. It depends. It depends on the nature of the relationship, and I shouldn't say the personal relationship, but the economic relationship between employer and employee. So I mean, there's an extent that an employer in some industries can reduce wages and not suffer, not lose employees and not suffer from that. But there's a sense that other employers are not able to do that. So I know this sounds totally economics, right? It depends. It depends on, something we call the elasticity of the relationship between the workers and the employers. And so, yeah, some employers are going to cut wages and some employers are not going to. Well, that's ultimately going to work the way it always works.
Thank you. Before we give you a well-deserved round of applause, I just want to say that the next 2 of these future Encore Learning Presents will be, the first one will be Monday, September 16th. It'll have Chuck Rosenberg come answer legal questions.
That's a good one.
I'm sure we have a lot of them. And it starts early at 2:30. So it's a little early for a start. After that, we have another interesting show. God doesn't want you to read that. Religiously based censorship in America. That's back at the normal time, Monday, September 30th, 3 to 4:30. That'll only be virtual. And I think Rosenberg is only virtual as well. So again, now please give